So today we'll be talking about a simple tool with a great utility in ophthalmology clinic, which is the fluorescence strips. It is a strip, paper strip, this one, impregnated with sodium, fluorescent sodium. And if you have this kind of tool, usually they write it as they have their own brand name, and this one is OptiGlow, and they have mentioned it as USP, which is kind of a standard which we can rely on, and it contains 1 milligram of fluorescence sodium. It has been written here we have to store it in a cool dry place and for external use only, and rest of the things are about export and where it is manufactured. And so this tool is a very important tool, and it can be it's seen in everyday day-to-day basis usage in eye clinics. And usually if the indications are usually if a patient comes with trauma, so to diagnose abrasion and all, it is very useful. So whenever we want to diagnose a corneal abrasion, we just use you can use any eye drops, you can use a normal saline also, you can use antibiotic drops or any artificial tears, and with this strip, fluorescent strip, and put it in the usually we put it in the lower palpebral conjunctiva, between the 2/3 and 1/3 of the lower palpebral conjunctiva. And what we do is we ask the patient, we examine the patient under slit lamp examination, and not by the usual slit lamp light, but we use the filter which is cobalt blue. So if you use the cobalt blue filter, it is the diagnosis is accentuated, and we can see the epithelial defect at the aberration reflecting as a yellowish green defect, which is positive for corneal aberration, which is usually can be seen under normal light, but it is more accentuated in cobalt blue light. So always use a cobalt blue light in slit lamp. And also we can use this to diagnose evaporative dry eye, and we usually use this for to check intraocular pressure when we are using Goldman applanation, and also Siegel's test. So there are so many usage with this simple tool. So this is a very important tool when we are in the clinic. So we have to know how to use it, even for especially in dacrology, if we are going to diagnose whether there is a blockage in the lacrimal duct system, we can use this. And if there is especially in congenital nasal lacrimal duct obstruction, where it is invasive to use syringing, lacrimal syringing, we can use this non-invasive way to diagnose nasolacrimal duct, congenital nasolacrimal duct obstruction. So a lot of usage with this one.